The Weight Loss Surgery channel is proud to partner with RenewedReflections.com for weight loss surgery support. Share encouragement, strength, and hope with new friends online. And get the skinny on different weight loss surgery procedures from a resource you can trust. All at RenewedReflections.com.
Clinical depression is a serious disease that affects millions of people in North America. Researchers have concluded that depression in itself does not appear to increase the risk of obesity. But can the drugs used to treat depression be a factor? Some researchers think so. A recent study out of the Hotchkiss Brain Institute of the University of Calgary and the School of Public Health of the University of Alberta examined data from the Canadian National Population Health Survey, a 10-year-long study of a representative sample of household residents in Canada. The researchers found that patients diagnosed with a major clinical depressive episode were no more likely to become obese. Unexpectedly, the researchers did find a link between obesity and the use by patients of a specific type of antidepressant medications, the serotonin reuptake inhibiting antidepressants, or SSRIs. These include Paxil and many other widely used antidepressant drugs. The researchers concluded that depression itself does not appear to increase the risk of obesity. However, obesity does increase the risk of having a major depressive episode in certain cases, and the treatment of these episodes with antidepressant drugs may be associated with an increased risk of obesity. The researchers suggested that psychiatrists come up with strategies to offset this risk when prescribing antidepressant drugs to patients with depression. In our last story, some people think that weight loss surgery is a treatment best suited to the young. However, a new study by Baylor University Medical Center in Dallas says that's not so. The study, presented at the 26th annual meeting of the American Society for Metabolic and Bariatric Surgery, found that seniors can benefit from weight loss surgery just as much as younger people and with no additional risk to the patient. Researchers looked at data from a sample population of 100 obese patients ranging in age from 65 to 77 years old and compared these with data from a younger sample population. All the patients had laparoscopic gastric bypass surgery between January 2005 and July 2008, and all experienced comparable levels of weight loss. The numbers of postoperative complications were almost the same in both groups as well. The study's authors conclude that despite age differences, older obesity patients are just as likely to benefit from weight loss surgery as are younger patients and are no more at risk of developing complications afterwards. And that wraps it up for another edition of Weight Loss Surgery News. If you have a story you think we should cover, be sure to drop us a line at news@weightlosssurgerychannel.com. You can also find us on Facebook or send us a note on Twitter. We love to tweet. I'm Leslie Thompson, and we'll see you next week. Bye-bye.